15th of Feb is approaching and few people are stressed out because UK government didn't officially communicate any updates regarding the UK healthcare visa. So, quick reminder to you guys, last year on 15th of Feb 2022, UK healthcare jobs were added in the UK shortage occupation list so that UK could bridge the gap of labor shortages that they were facing in the healthcare industry. So today I'm sharing a good news for everyone who's looking to migrate to the UK on the healthcare visa, because UK is still facing acute labor shortages, which means you still have a high chance to get visa sponsorship in this field. But remember, preference will be given to the UK candidates who are currently in the UK on any kind of visa category, even with zero experience in this field. The next preference will be given to the overseas applicant who got some experience, and the third preference will be given to the candidates from overseas with less or no experience. So just be patient with yourself and gain more experience in your country and keep applying for jobs in the UK. So what was announced by the UK government on 10th of Feb 2023? If you want to know the new announcement, make sure to stick with me till the end. Hello guys, I'm Sarika and welcome to Your Knowledge Buddy. If you guys want to connect with me on Instagram, my ID is Your Knowledge Buddy, where I do post more updates frequently as compared to YouTube. So make sure to come and say hello to me. And if you wish to book my one-to-one consultation, you can also do that via the link provided in my video description. So without any further delay, let's begin with the new announcement. So on 10th of Feb 2023, Department of Health and Social Care announced the International Recruitment Fund for the adult social care sector, that they will give £15 million fund to help tackle the barriers of international recruitment for the adult social care sector. This is such a positive news. This fund will be given to be used from now 2023 till 2024 to help support international recruitment within the adult social care sector. UK government recognizes that many care homes find it difficult and experience a number of different barriers while recruiting from overseas. So this fund is being established to provide employers with a range of support mechanisms so that they are able to take advantage of the benefits presented by the international recruitment. It is also designed to help ensure an ethical approach to recruitment and employment practice, and that international recruits are provided with a range of support to help them make an effective transition to working in UK. So the aim of this fund is to provide collaborative arrangements to reduce administrative complexity and burden, mainly for small and medium-sized enterprises providers. So let's take an example. This local support arrangements will help care homes with identifying overseas candidates like you, which means helping care homes finding the right candidates through interview process and helping them with international recruitment. So all the overseas applicants are welcome to apply. They will also help care homes completing sponsorship license for them and visa applications for their successful candidates. They will also help them with onboarding process. So this announcement is a clear indication that they want to keep care workers on the UK shortage occupation list, else they would have not provided the funding of £15 million to recruit international candidates for healthcare jobs. They recognize the labor shortages in the UK in this sector and understand the pain in the care homes which they go through, as they are facing huge difficulties in recruiting right candidates either in the UK or from outside the UK. Hence, this new funding of £15 million will help to smoothen the whole process, and also it will make the process faster in bringing candidates from overseas. They also understand the other challenges faced by people who migrate here, like pastoral support, housing and travel. So this funding can also be used, number one, helping providers attract overseas candidates. Number two, a shared recruitment resource that looks at the whole region needs. Number three, providing an advice or checking service for sponsorship license or visa applications. Number four, helping new arrivals to access affordable housing. Number five, helping international recruits with solutions to work travel requirements, for example, helping them gain a UK driving license. Number six, developing pastoral support such as budding schemes. They had also mentioned that the main focus of the support services will be on the recruitment and employment of care workers. However, the interventions could also support the recruitment and employment of other adult social care staff, including nurses, occupational therapists, and social workers as well. In the other section of announcement, they have outlined how care homes can reach out to them and define the whole process for them, and hence I will not discuss that in detail here, as this will not be beneficial for you guys. But I'm excited with this news and I hope many of you get successful this year. So let's talk about the timelines now. So there are two timelines. Timeline 1 for 2022 to 2023 funding, and second timeline is for 2023 to 2024 funding. So for timelines 1, you can see from the screen that this funding is already launched on the announcement date, which was 10th of Feb 2023. So any care home, however big or small they are, they can bid to access this funding by submitting their proposal latest by 24th of Feb 2023. Department of Health and Social Care will take 1 week to review your request, which is 3rd of March, and by 6th to 17th of March, they will approve the payments and hopefully make the payment soon, and will make the payment soon after, so that the care homes can continue in their journey to recruit care worker, whether internally or from overseas. And for the second timeline of 2023 to 2024, from my screen, you can check those important dates, which are for care homes. Now, next part of the announcement was about some guidelines on how they can make this whole process work effectively. First, they talked about like care homes should take advantage of shared recruitment activities where companies come together and create a shared job board, making it easier to reach people who want to apply from abroad. Second point was ethical recruitment. They re-emphasized on international recruitment adheres to the code of practice. You may hear that the few recruitment agencies, they are charging 10 to 12,000 pounds to give you a job offer and visa sponsorship. So make sure you complain about such care homes or agencies, as they should not be charging a single penny to give you visa sponsorship. Hence, now support could include advice for providers about the code of practice and how to use ethical recruitment agencies. It could also be focused on providing safeguards for employees. Recently, there was news that few students were being exploited in care homes. So if you think you are being exploited, you should report to Department of Health and Social Care. Third point was travel to the UK. New care workers will need to book flights and transfer their belongings. Hence, they will see how together they can come up with a joined up approach which can ease the burden on care providers by taking examples from the NHS nurses who are executing the whole plan beautifully. Fourth point was affordable accommodation. We all are aware of accommodation shortage in the UK, and it's more difficult for anyone moving new to the UK as they face difficulty in getting home due to no domestic credit history. So they will be helping you, providing temporary accommodation at scale or support with finding flat shares. Fifth point was onboarding and induction support. Department of Health and Social Care knows that the best practice is to collect new international recruits from the airport, introduce them to the local area, and accompany them on the first day to their new home. But they also understand that this can be burdensome for some providers, and hence they have identified examples of how local partners have come together to provide a joined up approach. When this is done collaboratively, it can include helping new arrivals to set up a bank account, register with a GP, and enroll children in local schools. Sixth point was travel within the UK. Since you guys will have to travel to care homes or travel to users' homes, you should know how to travel within the UK. Examples of support they can provide is include a joint approach to helping care workers acquire UK driving licenses or cycle to work schemes. Seventh point was pastoral support. UK government recognizes that it is important that the new arrivals in the UK are supported and feel welcome. Hence, they encourage you guys to include joining up to offer access to support networks, peer support, budding and training and learning opportunities. So before I wrap this video, I'll encourage everyone to go and apply for the jobs now. There are still plenty of care homes and recruitment agencies who are hiring. This is your golden opportunity if you want to migrate to the UK. Just don't give up. In my last video, I have covered 49 companies in the UK who are currently hiring various roles under medical and healthcare. Make sure to go and watch that video and start applying for the jobs now. On that note, I'm going to say goodbye for now and see you soon with my next video. Till then, keep learning.